Ready to shine inside out? Welcome to Polished Beauty Podcast, where ambition meets empowerment. We talk business, beauty, brain, body. I am your host, Dr. Daisy Ayim, triple board certified cosmetic surgeon and OBGYN. Let's get polished. This episode is so thrilling. We are going to talk about Ozempic Face. Before Ozempic Face, there was just, I want to lose weight. Everybody was on this medication. Ozempic, Mounjaro, Wegovy, you name it. There were so many variations of the GLP-1 agonist or receptor agonist that was out, and everybody was taking it because they wanted to lose weight, and it was working. You were losing all this weight, and you were excited. But here comes the problem. There was all this potential, or not potential, actual happening, things that were happening to your body that you did not expect. Yes, you lost all this weight, and now you had all this other stuff, and you had to deal with it. But we're going to focus on the face. We're not going to focus on the body. We're going to talk about the face and the effects of Ozempic usage and what happens to the face. So we're going to talk about the science. We're going to learn about how to optimize the volume that is lost and restore facial harmony that happens with this medication. So welcome to this episode, you guys. I remember when Ozempic came out and some of the other GLP-1 receptors agonists, I was receiving the phone call in my office, just like many offices were getting this phone call. Do you provide it? Can I get a prescription? I want to get on this. And I had to stop really abruptly and say, let's approach this holistically. Before jumping on these medications, let's talk about lifestyle. Let's talk about sustainability. Let's talk about longevity. Because I have done this long enough to see that there's a wave of things. You know, first we had ACG shots that was like taking the nation by storm, and so many people jump on it, and that fade away, and the weight came back. Now we have this. So I was one of the few, I think, physicians' office that was not offering these medications, and still isn't really. Ozempic Face. What do you think it is? It is exactly what you think it is. You look changed. Your face looks sunken. You have all these facial features that you didn't sign up for. You've seen it in the celebrities. You've seen it in someone that you know that's taking this medication. So let's get into the science. The first key features that happens when you take Ozempic to your face is obviously loss of facial fat. What I mean by this is that you do have superficial and deep fat pads on your face. When you are losing weight, the face is the first area to show weight loss because the fat concentration is just less. So you're going to show more on your face than your body. So you lose both of this superficial and deep fat pad. And the areas that this is highly concentrated is usually on your cheekbone area and your temporal area. You lose this fat and you look sunken. So you have like this hollow look. Call it this death-like look, this skeleton-like look, okay? And when that happens, your hollowing and your sunken cheek obviously stands out, right? Your tear trough, the fat pad there is lost as well, and that is something that affects a lot of patients, okay? So when you lose this fat, your bony structure becomes more prominent. What that means is that your jawline or your cheekbones are just more pronounced. It may sound in theory like this is fantastic, but a lot of times actually it's unflattering because the design of those structures are meant to have nice draping and cushioning to give you that look that you imagine. So when you remove the fat, you just have bones, so it's not as flattering. So that's one thing that happens. Your bony structure becomes more prominent, and your eyes, which is your orbital bone, your cheekbone, and your jawline are just more pronounced. Another thing that happens with the Ozempic Face is your skin. Because you've lost all this fat, you just have redundancy of skin, sagging of your skin, laxity of your skin, and that's something that nobody wants, right? Because it ages you. You don't want to look on your face and you see redundant skin, I mean, you're going to have that naturally as you age, But why expedite that process? And that's what Ozempic does. It takes you there faster, sooner, quicker, and you have to be aware of that. The other thing that happens with Ozempic is that because you have this sagging and redundancy of skin, you tend to have more wrinkles. Yeah, your skin shows more wrinkles, more texture irregularities. And that's something that obviously you don't want that. I mean, I'm sure nobody signs up for that, but it does happen. So be mindful of that aspect of Ozempic face. And then lastly is what we call elongation. Your face just looks longer. And sometimes before Ozempic face, fillers were used to give you this elongated look. But notice that volume was added to give you this look. When you lose fat, to have this look is not as flattering. So depending on the individual, some may look good, but for the vast majority, it's just not flattering. So that is your Ozempic face. I've given you a couple of things to identify Ozempic face. Number 1, loss of facial fat. Number 2, hollow cheeks and temples. Number 3, prominent bone structures. Number 4, skin sagging and laxity. Number 5, your under eye fat changes. That's your tear trough. Number 6, increased wrinkles and fine lines. And number 7, this deflated, elongated look. So that is your core feature of an Ozempic face. That's what we talk about when we say someone has Ozempic face. And off-road guys, I get a lot of consultation in my office for facial harmony, for facial rejuvenation because of this. Although I do not prescribe Ozempic and other counterparts in my office, I do treat patients with this. So if you are on this medication and you have this side effects, yes, I have the tools and the gadgets and the surgical techniques to handle this. And we're going to talk about how do we fix Ozempic face, okay? That is coming up. But for right now, focusing on the features of Ozempic face was what I wanted everyone to get and the signs of what is happening. So, rapid fat loss targets the face first. Remember that. When you're on Ozempic and you're losing weight, you're thinking, gosh, I want to lose weight on my stomach, on my love handle, on my back brow row, inner thigh. But unfortunately, fat is lost first in the face. And as I mentioned, that's because it's such a small area that when you're losing weight rapidly, it makes sense for that to happen first, okay? The second thing to keep in mind is that the role of these fat pads is for you to look youthful. Remember when you were younger, in your teens or your 20s, your face looked full, plump, just healthy and vibrant. That's what you're looking for as you get older. But when you take Ozempic, you scale up your age 10, 15, 20 years. So the role of facial fat pad is very important in facial harmonization. Your collagen in your skin is another thing that's very important. Remember, in your 20s, I don't know if you're listening to this in your 20s or you're much older, but just try to pinch your jawline, the skin on your jawline, and drag it and see how easy it snaps back, or does it even pull? In your 20s, it was very hard to pinch that and pull. It would give you nothing. But in your 40s, 70s, you barely pull it and it just stretches and gives and gives and gives. That is your collagen, okay? So Ozempic rapidly destroys that. So you don't have that snapback, recoil, contraction, tightening of your skin. So another thing to keep in mind, if you're over 40 and you're taking Ozempic, you're more likely to show this Ozempic face. So for the younger patients that are taking this in their 20s or 30s, you have a little edge just because of your age. Over 40, the edge is not there. You lose more rapidly just because it's aging, all right? If you are skinny or smaller or have less fat distribution on your face, you're more likely to have an Ozempic face just because your starting point of fat is less compared to someone that had more fat. So keep that in mind, okay? And then your genetic predisposition. There's just some patients that will show more of this Ozempic face than others just because of their genetic makeup. So keep that in mind. Not everyone is going to have all those presentation of Ozempic face while taking the medication, but there are others that have all of them or some of them. All right. So I have talked about the presentation of an Ozempic face. Now let's talk about how do we fix it. How do I fix the Ozempic face? Well, prevention is better than cure, right? So I always tell patients, if you're doing Ozempic or trying to lose weight, you want to do it very slowly and gradually, because that helps with not having this rapid drop. You know, where you go from point A to point D, skipping 2 steps. So if you do it slowly, you go from A to B to C to D, and that really helps the skin and the fat just smooth it out and sort of, check itself well before it continues again. And then I tell patients, consider volume restoration as you are losing weight with Ozempic. What do I mean by that? You start doing derma fillers as you're taking Ozempic. Don't wait to the end and you have this full-blown Ozempic face and you want to do a filler at the end. You can do it while taking the medication gradually. So that's another thing. Prevention is better than cure. Change your diet, increase protein. The high protein will help with collagen, it's a building block. So it helps with your collagen depletion. So think of consuming more protein and drinking lots of water. Hydration is always good for the skin. So those are your preventive action to help this Ozempic face. But let's get into the non-surgical option, the things that I do in the office to help my clients. Well, there are several things that we can do. The first and obvious one is replace the volume with derma fillers. I kind of touch on that. These are your Juvederm, Restylane, RH collectors. This helps restore volume. They contain hyaluronic acid, so you can work on your nasolabial folds, on your cheek bones or your cheeks. You can work on your temporal area. So derma fillers is a good way to restore volume. You also have your biostimulators. I'm talking about your radius and your Sculptra. These are helpful because it stimulates your own body to produce collagen and it helps restore volume in those areas. So your fillers, your derma fillers, which is hyaluronic acid based, or your biostimulators, which is your radius or your Sculptra. Then you can also consider skin tightening treatments, radiofrequency based. I usually would recommend something like a Morpheus 8. This is very helpful to restore the skin texture, helps with skin tightening and contraction. And that's something that you can do from your chin to the top of your, or the edge of your head, right to your hairline. So Morpheus 8 radiofrequency microneedling, that's a very good procedure to help with skin tightening. You can also consider FaceTite. FaceTite is a radiofrequency-based device that's also used to help with your lower face and your neck. It helps tighten, contract the skin, and it's a very gentle way to get facelift results without having the scar. So think of it as your non-surgical facelift or your scarless facelift. That is your FaceTite. So if you have sagging, a turkey neck, or your jowls are sagging, or your lower face, the contour of the jawline, you can consider FaceTite. And that can be done simultaneously with a Morpheus 8 procedure. So radiofrequency devices help with that. Then you have your regenerative techniques, like platelet-rich plasma, platelet-rich fibrin, exosomes. These are things that can be used to help restore your face from an Ozempic face. And then you just have a good skincare product. So you need medical grade skincare products to take care of your face every day. And you want to make sure you have all those stuff like your peptides, retinoids, hyaluronic acid in the skincare products that can be helpful in rejuvenation, okay? So those are your non-surgical options. Your surgical options are very easy. If you lose fat, you need to replace fat. How do you replace fat? You do fat transfer. The caveat with that is that because you're losing weight on Ozempic, you are losing weight in your entire body. So if your face needs fat transfer, where do we get this fat? That's usually a challenge. I find that sometimes where I like to take fat to do a fat transfer, there's just no fat. Your abdomen, your inner thighs, your arms, So although fat transfer is a solution, for some patients, there just may be no fat to remove from one place to restore to the face. But fat transfer is an option. Surgical facelift is an option. Full facelift, mini facelift, lower facelift with neck lift, basically some sort of surgical excision to cut out the excessive skin. That is a treatment option for Ozempic Face. And obviously, finding the right surgeon to do that is something that you should always keep in mind. I always tell patients this, when it comes to weight loss with this medication, remember, less is more. Take your time losing the weight. Don't try to do it too fast, too quick, too soon, because you'll have too much of a change and your body will not adapt easily, and you're more likely to have this Ozempic face, okay? Less is more. Remember, holistic cosmetic surgery or holistic weight loss is how you want to approach this. You want to focus on your nutrition, you want to focus on your lifestyle, and then you want to use this medication to kind of create this trifecta pillar. And your treatment is really identifying the effect and treating that effect, right? So Ozempic Face can be very distressing side effect that you did not sign up for when you're taking this medication. It is something that can be improved with modern aesthetic techniques. And someone like myself, a cosmetic surgeon, can help you restore this Ozempic Face back to a normal, harmonized facial feature that you had in mind. If anything, just remember, because something is a trend doesn't necessarily mean it's for you. So before jumping on this bandwagon, ask yourself, why do I want to do this? Is it because it's everywhere? Is it because it's easy? Or is it truly a tool in my toolbox in my weight loss journey? And that's how you really want to approach it. And when you do that and get the proper education, proper counseling, and the proper physician or healthcare provider to guide you through this process, the results can be long-term, sustainable, and reproducible. However, when you are quick in wanting a result, you may end up with an Ozempic Face. So do not be a victim of that. And as always, my office here in Houston, Texas, I take care of all these patients with Ozempic Face. You can reach me, and if you have any questions, I'm always available.
I hope you enjoyed this episode, and thank you for listening. Video recording of this episode will be featured on our YouTube channel, Dr. Daisy Ayim. We are also found on Instagram at Polish Beauty Podcast or at Dr. Daisy Ayim. Remember, a new episode drop every Wednesday, so stay tuned. Please like, share, follow.